Hello. Today I'm going to talk about art as a possible therapy for mental illness. And I just read a very interesting article about how the team in Louvre, Tokyo de Louvre, is starting a huge mental health project, helping people to ease their symptoms and improve the quality of their life if they have problem with some of psychiatric disorders. This idea is not new. A kind of art therapy programs already exist, for example, in Belgium and some other French museums, but I very much like the idea. I will tell you why. In my personal case, the feeling of the beauty, art, and what other people are able to create is very important to figure out my place in the world and what it offers, what is possible to see and enjoy. And it's very important for me. And I think that everyone who is wise enough to think about that should use that opportunity to increase quality of life, to increase that feeling that beauty exists, that it is a gift, that we should be thankful for having that. And I am intentionally using that whenever I feel a little bit moody or I have a problem to grind on and I give myself a break. I go to a museum, I go for a walk, visiting beautiful gardens, which, for example, Netherlands is full of, and it really lifts you. You don't have to consciously think about that, you just have to immerse and just observe the beauty around you. For example, enjoying the gifts of spring is very inspirational for me. Listening to the birds sing and walking through the woods is also, as one of the artists already make a beautiful comparison, that walking through the woods is similar to visiting a cathedral, because you have some sense of awe and you realize how small you are. Climbing up the mountain or walking through the woods, you simply have an effect in kind of thinking that you realize how your problems are small and solvable, and how your time here is really short. What we can extract any message from it is that we have the power to focus our attention on what we are going to spend our time on. Because if anything I learned from many wise men, and Mujica almost instantly comes on my mind, he explained really clearly what is the time. When you're paying something, you're not paying that with the money. You're paying that with the time of your life that you have to spend to earn that money to pay for something. So time is the most precious thing that you have. Don't waste it. I will just give you a couple of interesting details that I find in the article about this, and the title of the article, which I'm going to give you a link below, is "With Art Therapy on the Rise, France's museums are beginning to take mental health seriously. Palais de Tokyo is building a care center for art and well-being programs while new workshops launch at Louvre Lens." At the end, this is not new idea. I just wanted to point out that the first such a program actually started in Lille in 2012, where they start organizing programs with persons with various kinds of disability, but mainly I think they started on autism spectrum and Alzheimer's. And that actually had root in various museums in Europe. For example, in Belgium, they started also very beautifully envisaged programs for kids, because you have to teach them on beauty very early, so they incorporate that in their worldview. I also wanted to add some comment on everything that I already said in connection to museums starting organizing programs as a kind of help and support in mental health care problems. But in the end of the text, I really had an itch, and I was thinking, they're already trying to look at this as a business model. Because I know that during this pandemic, among others, museums were really having a huge blow because of the lockdowns and things like that. And they all have financial hurdles now. But I think that apart from seeing that as an opportunity to organize and motivate people to visit museums, I think we should all have a kind of awareness that the art is a way to help us, to lift us, to improve the quality of our life. People working in museums really had to be creative to recuperate after almost 3 years of really serious and existential problems, let's face it. But this is the discrepancy between the educational system, which used to highly praise art and something very important in life. And this is not very much so in the last 20 years, because I'm aware of that, because sometimes when I tell someone so enthusiastically that I visited a museum, that I'm planning to do this and that, I can see in their eyes that they are not sharing that enthusiasm, thinking that, why she thinks that the art is so important. Because it is. Because it is sublimation of everything that humankind was thinking about as important. I think it's existential for us. Because, for example, as I mentioned in one of my previous videos, when I look to the cherry blossom with the back of clear blue sky, I immediately think of Van Gogh. And I know how tormented he was. He had very, very harsh life. And he actually survived so long, and he gave so much and created so much because this was his only channel how to grapple hope, how to forget about hurdles of life. So I'm not advocating here that we should forget about our problems, but maybe that beautiful painting or photograph or some other object of the art or a beautifully crafted garden can move something within us which is there. And this is our feeling for beauty. You also have to train your eyes for beauty to recognize how important and therapeutic it can be. So again, I'm all for this idea that art indeed can be very therapeutic in our lives. And they say in the end of this very interesting text that they would love to see psychiatrists and those professionals working with patients to recommend visiting such museums as a kind of therapy. Why not? I'm all for it. And I also recommend you to think about that in your daily life. Visit museums. You can find a lot of places that can really cheer you up, and museums are definitely such a place that are lifting your mood, at least in my case, and I'm highly recommending that idea. Thank you for listening.